Some people think that dogs only need parasite protection during the spring and summer months, but parasites can be present in all parts of the country all year round. That's why the Companion Animal Parasite Council, the American Heartworm Society, and most experts recommend that you keep your dog on monthly heartworm prevention all year long. After all, heartworm disease is one of the most deadly threats to your dog. Spread by infected mosquitoes, it's a serious problem. Keep in mind that heartworm preventatives work by killing infective larvae from mosquitoes that have already bitten your dog. So remember to give your dog her heartworm prevention after her last exposure to mosquitoes. If you don't administer Trifexis year-round, it's important to give it to your dog for 3 consecutive months after exposure to mosquitoes. When you give your dog Trifexis all year long, you not only get the benefit of protecting against heartworm disease, you're also guarding against fleas and intestinal parasites. Fleas can be found both indoors and outdoors in all areas at all times of the year. They're not only annoying, but fleas can be dangerous to your pet's health. They can cause your dog to have skin inflammation, blood disorders, and even some types of tapeworms. Your dog also requires year-round protection from intestinal parasites or worms, which are a constant and widespread danger. Dogs contract worms by ingesting worm eggs in larvae and feces, in animal remains, or in infected soil. They can also be infected directly from their mothers, while she's still pregnant or while they're nursing, or even through skin penetration. Intestinal parasites can cause lots of health problems for your dog, and in some cases can even be fatal. It's not worth the risk. Make sure your dog is constantly protected from these dangerous parasites. Your veterinarian can advise you on the best protection schedule for your dog, so be sure to talk with him before making any changes to your dog's preventative plan. Ask about Trifexis, the combination product that kills fleas and prevents infestations, prevents heartworm disease, and treats and controls hookworm, roundworm, and whipworm infections. See the full product label for complete safety information. Serious adverse reactions have been reported following concomitant extra-label use of ivermectin with spinosad alone, one of the components of Trifexis. Treatment with fewer than 3 monthly doses after the last exposure to mosquitoes may not provide complete heartworm prevention. Prior to administration of Trifexis, dogs should be tested for existing heartworm infection. Used with caution in dogs with pre-existing epilepsy. The most common adverse reactions reported are vomiting, depression, itching, and decreased appetite. To ensure heartworm prevention, observe your dog for 1 hour after administration. If vomiting occurs within an hour of administration, redose.